Thank you, Mr. President. There are 9 female senators. That's it. If we do some simple math, we realize pretty fast that that's a problem. 50% of our population, women. Just 25% of our senators here are women. Women's rights, ability to choose what to do or not to do with your body and with your doctor shouldn't be a problem. But it seems to be a problem, and I'm not certain, but it seems to be a problem partly because women are not in power in society. And I know you may say, well, the author is a woman. I just left the Middle East area where women's rights are, in Saudi Arabia, they can't even necessarily drive, and girls aren't necessarily prioritized to be able to go to school, but they have the right to choose what to do with their body. Them and their doctor. They have the right to choose whether or not it's healthy for them or not to have a child, and for whatever reasons they can say after 12 weeks, and they still can have the right to make that choice for them, even in a country that is slowly going forward in women's rights. As I stand on the Senate floor, I was almost pushed to silence because I can't believe the regression that I'm experiencing, that I'm seeing about us making decisions about our bodies. I'm in a Senate district that doesn't have a hospital, but I'm doing a bill, and I'm seeing a bill being done that requires access to health care. I know the senator from the 6th understands what I'm saying because people don't even have access to basic health care. But now we're going to believe that they can have access to go and get an ultrasound from people who are not even medical professionals. Unfortunately, here in America, we seem to be going backwards, and I guess we want to be one of the 3, Minority Leader, that goes backwards in the nation for women. This bill is another backward step as part of our government, and we are putting roadblocks to the freedom of women. This bill has been cleverly crafted, though. I thought of doing an amendment that says, well, we should also do like the senator from the 28th said, and we shouldn't just protect women and make sure that they have care. We should make sure men don't have heart attacks and make sure that they have penile probes to make sure they actually need Viagra. I started to do some amendments along those lines because shouldn't we protect the men in the state? But I said, we know that the reality is that not only should this bill be done, but should we be requiring that if men are going to get Viagra that they have a certificate from their significant other to really suggest whether or not they really need the medication? Really? Don't we want to protect the men like we protect the women? But I decided instead to say that this bill has been cleverly crafted, really does put up barriers and roadblocks to the right to an abortion. I would almost appreciate if we just called it what it was, instead of pretending that we're trying to provide a different, higher level of quality of care. Just say, I don't agree with abortion, and I want to put up all the roadblocks I can between a woman and her right to make that choice. Say it. I just like calling a spade a spade. It isn't a question of whether or not a woman should or should not get an ultrasound before an abortion. And I appreciate the senator from the 24th calling it what it is, a vaginal probe that you're requiring a person to get when they're getting a medical procedure that they have the right to do. It's a right that's been granted and affirmed by the Supreme Court of the United States of America. It's our duty to uphold that right for people. You know, I'm elected. I didn't get 100% of the people voting that voted for me, but I still represent the other people, whether they voted for me or not. Whether you agree or don't agree that the Supreme Court upheld the right, people have the right for us to protect their rights. It's our responsibility to protect them. No matter our personal opinions or beliefs, the government does not belong in the womb of women of the United States of America. Even the Middle East gets it. For their women. Unfortunately, if we pass this bill, we will be in much more personal places than a woman's womb. We are looking at a bill in which government invades the most private parts of a woman's body, when we know we have not even provided access to what we're saying that is mandated. I appreciate the senator from the 27th. Your daughters should be proud that you have stood up and your mother has raised you so well. As a mommy, I appreciate that you stand up for women. But the government has gone into the wombs of women, and I think it's wrong. I can't stay silent. I have to say that they've invaded the most private parts of a woman's body. Requiring transvaginal ultrasound goes too far. It goes too far. We don't require men to have penile probes when they give Viagra. They give Viagra from insurance. We don't require that insurance provided for birth control, nor do we require it even in this situation, that this mandatory invasion into a woman's womb is, in her vaginal area, is going to be required by insurance. I hope it's uncomfortable to hear the realities of this bill and what it does. I think that there should be parity in the law. I think that women should not be the only ones who are dealing with the injustice of being invaded, that their freedoms, I don't think, should even be invaded. A woman and a man are equal, and if we don't deem it appropriate or safe for men, because, you know, if your heart isn't right, you really maybe shouldn't be taking those pills. We need to recognize that each person knows what is best for them. I tell you, when we began to respect the human capital in Wisconsin, we might find our job numbers even change. When we can respect our diversity, not only in color, but in women and their ability to choose what to do for themselves. When we realize that we don't walk in other people's shoes and that we should not dictate our experience on what their decisions should be. So please, let the women of this state decide for themselves. Let's not have a mandatory requirement that can't even be filled because there is a lack of medical coverage. Let us not support this bill. Let us not move backwards. Let us not be an embarrassment